Hello, I'm Dr. Jeffrey DeSarbo, and welcome to the Eating Disorder News Network for April 2010. Treatment providers are often looking for complementary and adjunctive treatments for eating disorders that show evidence of promise. A pilot study from Seattle Children's Hospital in Seattle, Washington, assessed the effect of individualized yoga treatment on eating disorder outcomes among adolescents receiving outpatient care for eating disorders, including anorexia, bulimia nervosa, and eating disorder NOS. A total of 50 girls and 4 boys, aged 11 through 21 years, were randomized to an 8-week trial of standard care consisting of every other week physician and/or dietitian appointments versus individualized yoga plus standard care. Outcomes evaluated at baseline, end of trial, and 1-month follow-up included the eating disorder examination, body mass index, Beck's depression inventory, state trait anxiety inventory, and food preoccupation questionnaire. Researchers found that the yoga group demonstrated greater decrease in symptoms with eating disorder examination scores, which decreased over time. While the standard care with no yoga group showed some initial decreases with symptomology, eating disorder examination scores returned to baseline by week 12. Food preoccupation, measured before and after each yoga session, decreased significantly after each yoga session. Additionally, both groups maintained current BMI levels and did show a decrease in anxiety and depression over time. The standard care with no yoga group was offered yoga after study completion as an incentive to maintain participation. A report out of Stanford University examined the effectiveness of dialectic behavioral therapy, or DBT, for binge eating disorder and its ability to reduce binge eating by improving adaptive emotion regulation skills. While preliminary findings from other studies had been promising, they only compared DBT to a waitlist group. This study aimed to compare DBT to an active comparison group therapy approach. 101 men and women meeting DSM-4 BED research criteria were randomly assigned to 20 group sessions of either DBT or active comparison group therapy. The study showed that the DBT group had a significantly lower dropout rate of 4% compared to 33%, and that post-treatment binge abstinence and reductions in binge frequency were achieved more quickly for the DBT group, with an abstinence rate of 64% for DBT versus 36% for active comparison group. However, these differences did not persist over the 3, 6, and 12-month follow-up assessments, and secondary outcome measures revealed no sustained impact on emotion regulation. The authors of this study summarized that the lack of differential findings over follow-up suggests that the hypothesized specific effects of DBT with BED do not show long-term impact beyond those attributable to nonspecific common therapeutic factors. Aripiprazole, sold under the brand name of Abilify, is an atypical neuroleptic medication used on-label for conditions such as bipolar disorder, schizophrenia, and as augmentation to treating depression. In recent years, there has been much interest in the use of atypicals for eating disorder treatment. However, newer, more weight-neutral medications have not been studied with anorexia nervosa, and there are no reports of the use of these medications in bulimia nervosa. This report from the International Journal of Eating Disorders discusses the treatment of 8 patients, 5 with anorexia nervosa and 3 with bulimia nervosa, with aripiprazole for time periods of 4 months to more than 3 years. All 8 patients reported a notable reduction in eating disorder-specific anxiety, an effect not reported with the antidepressants alone. Patients also reported substantial decreases in obsessional thoughts about food, weight, and body image. 3 of the 5 anorexia nervosa patients restored weight to a normal range BMI, and the 2 others who were early in treatment showed partial weight restoration. The 3 bulimia nervosa patients in this study showed complete or near complete cessation of binging and purging. 7 of the 8 patients demonstrated decreased cognitive flexibility that extended beyond their eating disorders, and they also became more interested and engaged in social activities. In summary, while these findings are encouraging, they support the need to perform controlled trials of aripiprazole as a monotherapy as well as augmentation with antidepressants to prove whether this drug is efficacious in treating eating disorders. Various studies in animal models suggest a major role of brain-derived neurotrophic factor, or BDNF, in feeding regulation. Furthermore, other studies have shown that altered BDNF blood levels have been associated with eating disorders and their related psychopathological traits. A study out of Spain investigated the correlation of the Eating Disorder Inventory, or EDI, scales with BDNF plasma levels. Since the influence of BDNF on self-reported EDI scores had not been tested, BDNF levels were measured by enzyme-linked immunosorbent assay, and the EDI questionnaire was administered to a total of 81 eating disorder patients. Results showed that BDNF plasma levels were negatively correlated with the EDI total score, interoceptive awareness, and maturity fears. While subdividing according to the main diagnosis, interoceptive awareness presented significant correlations with BDNF blood levels in both the anorexia nervosa and bulimia nervosa groups. This reported data suggests that BDNF levels may influence the severity of eating disorders by modulating the associated psychopathology, in particular through the impairment of interoceptive or sensory stimulus receptor awareness. Neurotrophins such as BDNF are small proteins secreted in the central nervous system that play a crucial role in neuronal cell life and death. A related study from the Center of Genomic Regulation in Barcelona, Spain, looked at the role of neurotrophin network in eating disorder subphenotypes. Researchers explored whether members of the neurotrophin family are disease-modifying factors of quantitative traits, potentially contributing to the outcomes or prognosis of eating disorders. The research studied lifetime minimum and maximum body mass index and age of onset of the disease in a sample of 991 eating disorder patients from France, Germany, Italy, and Spain, and analyzed 103 genetic variants located in 10 candidate genes encoding for different neurotrophins and their receptors. Researchers discovered that variants in ciliary neurotropic factor and its receptor, and in neurotropic kinase receptor 2, which is the high-affinity receptor of BDNF, were significantly associated with a lower age of onset for eating disorders. Also, one variant in neurotropic kinase receptor type 1 was associated with a higher minimum BMI. The results suggest that for these two subphenotypes and the neurotrophin variants, they may act as disease-modifying factors and add preliminary evidence to the global hypothesis that eating disorders are the result of complex interactions and reciprocal controls between the immune, endocrine, and central nervous systems. And finally, the Eating Disorder News Network was at the 2010 IADEP Symposium, Behind Closed Doors, Face-to-Face with the Client, which was held at the Swan Hotel and Convention Center in Orlando, Florida. The conference for eating disorder professionals had very good attendance, including an international forum from Europe, Canada, Central, and South America. In addition to workshops by leaders in the field such as Dr. Anita Johnson, Dr. Emmett Bishop, and Dr. Ovidio Bermudez, keynote presentations included important and useful information presented by attorney Lisa Cantor, who discussed how to deal with difficult insurance company issues when helping patients obtain coverage. Networking opportunities were present at meal times and in the exhibitor areas, and attendees had special lunchtime presentations, including a screening of the Italian documentary El Corpo della Donna and a theatrical interpretive dance performance by the Natananda Dance Company. Presenters and attendees had positive reviews from this year's conference with regards to the quality of the lectures as well as the accommodations. Next year's IADEP conference will be held at the Point Hilton at Squaw Peak in Arizona from March 3rd through the 6th, 2011. I'm Dr. Jeffrey DeSarbo from the Eating Disorder News Network, wishing you a healthy day.